Understanding the connection between trauma and eating disorders. Eating disorders are often linked to underlying emotional issues, and one of the most significant contributing factors is trauma. Trauma, whether it is childhood abuse, sexual assault, loss, or neglect, can leave lasting scars on an individual's psyche and lead to the development of maladaptive coping mechanisms, such as disordered eating. In this article, we will explore the connection between trauma and eating disorders, examining how traumatic experiences can contribute to the development of these conditions and the importance of addressing trauma in treatment. 1. Trauma as a trigger for eating disorders. Many individuals with eating disorders have experienced some form of trauma. This trauma may manifest as physical abuse, emotional abuse, sexual assault, or neglect during childhood, or it may be linked to traumatic life events in adulthood, such as the death of a loved one or relationship breakdowns. Coping mechanism. For many people, disordered eating becomes a way to regulate emotions or avoid painful memories. Restricting food, binging, or purging may provide a temporary sense of control or numbness, helping individuals escape from overwhelming emotions. Self-punishment. In some cases, individuals with eating disorders may use their body as a means of self-punishment. They may feel that they deserve to be punished or that their body is unworthy, leading to restrictive or purging behaviors. 2. The role of trauma in body image issues. Trauma can have a profound effect on how an individual perceives their body. In many cases, trauma victims experience low self-esteem, shame, and a distorted body image, which can fuel the development of an eating disorder. Negative body image. People who have experienced trauma may feel disconnected from their bodies or develop a negative body image as a result of abuse or neglect. This negative self-image can lead to the desire to control or manipulate their appearance through unhealthy eating behaviors. Hyper-awareness of appearance. For some trauma survivors, an intense focus on body image and appearance may stem from a desire to be accepted, loved, or safe. The need to control one's appearance may be a way to feel empowered after experiencing helplessness during a traumatic event. 3. PTSD and eating disorders. Post-traumatic stress disorder, PTSD, is commonly seen in individuals with eating disorders who have experienced trauma. Flashbacks, nightmares, and intrusive memories of traumatic events can trigger episodes of disordered eating as a way to cope with distressing emotions or to regain a sense of control. Emotional numbing. For some individuals with PTSD, restricting food intake or engaging in other disordered behaviors can serve as a way to numb emotional pain and disconnect from traumatic memories. Dissociation. Trauma survivors often experience dissociation, a feeling of detachment from reality, which may make it easier for them to engage in disordered eating behaviors without fully confronting the emotional distress that underlies these actions. 4. Healing from trauma and eating disorders. Addressing trauma is a critical part of treating eating disorders. Therapeutic interventions that focus on trauma recovery, such as trauma-focused CBT, EMDR, eye movement desensitization and reprocessing, or psychodynamic therapy, can help individuals process their traumatic experiences and develop healthier coping mechanisms. Trauma-focused therapy. These therapies focus on helping individuals confront and process traumatic memories, allowing them to heal emotionally and break free from the coping mechanisms that have developed as a result of trauma. Building healthy coping mechanisms. Therapy also emphasizes building healthier coping skills, such as emotional regulation techniques and stress management strategies, to replace the maladaptive behaviors associated with eating disorders. Key insight. Trauma is often a significant factor in the development of eating disorders. Addressing trauma through therapy and creating healthier coping strategies are essential steps in overcoming an eating disorder and achieving lasting recovery.